After 34 years in private practice, Dr. Victor Chan, an OBGYN, has a unique bond with his patients.
I'm delivering babies of people I delivered, multiple babies of the babies I delivered, which is always a special treat.
And after all this time, he's ready for his next chapter.
I'm looking forward to contributing to the shortage here in Sacramento very soon.
That shortage, highlighted in a report by Doximity, the largest online network in healthcare with more than 1 million members.
Was that Sacramento is at risk of a shortage because they have among the highest number of older OB-GYNs.
Using the average age of OB-GYNs in each city and the average number of deliveries per doctor, Doximity sought to find out which cities will be most in need of doctors who can deliver babies in the years to come. OB-GYNs are likely to retire before other kinds of doctors.
OB-GYNs tend to retire a few years earlier than most other physicians. Their average age of retirement is around 59, whereas most physicians are a few years older.
The notion of a shortage of OB-GYNs is supported by the American College of Obstetricians and Gynecologists. 7 years ago, the group projected a shortage of some 8,800 OB-GYNs by 2020. The group did not work with Doximity on their study, but agrees we need more doctors able to deliver babies. Dr. Chan says he sees this too and believes one issue the industry faces is that doctors are less likely to stay in one place for an extended period of time.
A lot of doctors are more mobile and they move to where there are opportunities, and sometimes there's fewer doctors who will stay in one community for 30 or 40 years.